Okay, so third trimester, video 3, we're going to work a lot on mobility, pelvic mobility primarily. So we're going to find our deep squat position. You can go deeper if you would like. We also can put a block under your butt too, just kind of depending upon where you're at. But really working on that low deep squat. We're here. We're going to rotate up and back. Rotate up and back. Really challenge yourself with that squat. Rotate and back. Rotate and back. Rotate and back. So name of the game here is really just focusing on that mobility. So opening up those legs a bit, and we're going to sit side to side. Good. Now we're opening up those inner legs as we go side to side. Again, you can have a ball or a chair here, just helping you glide nice and slow, side to side. Really working on breathing here. Okay, nice and slow. Good. Going on to our knees. One knee forward, one knee bent. Gonna pull those hips through. We're gonna lean forward, hip flexor, but also a bit of calf on that front leg. Your calves and your hamstrings get really tight here towards the end of that pregnancy. So we just want to make sure, comfort wise, if you're getting Charlie horses or leg cramps, keeping those muscles, getting as much blood flow as we can. So really important here to breathe as we're going through that. Good. Okay, a little bit more calf. We're going to go into down dog here to comfort, but again, kind of looking at pedaling out those heels left and right, just stretching out those calves and hamstrings. And then we're going to lower down and then shoot through for a cobra. Your range of motions here are going to be much different, which is fine. You can also sit it back and then launch even to tabletop, but just get that little dip in your pelvis is helpful to get that bit of extension here, and then back and down. And then you can pop it up one more time for some calf and hamstring work. You can also use the wall if you would like. Good. And then lastly, we want to go through a little bit of a 90-90 rotation format. So sitting in that windshield wiper format or that V-sit, we're going to go side to side, nice and slow, and then end in our 90-90. So one of my all-time favorite exercises. While you're sitting here, you can work on sitting. That's enough. If you want to add a little bit more, you can lean forward and lean back. If you've been doing my video series, you're well aware of how much I love this movement and really focusing on that symmetry side to side, and then flowing the other leg forward, finding that neutral pelvis, using that tool. If you've had hip pain or pelvic pain or any sciatica, any of that stuff during your pregnancy, you might feel a difference side to side, and that can a lot of times be contributing to that pain. And so really working on opening up those hips and creating that good symmetry, especially in your third trimester of pregnancy, is really important. So that's one of the reasons why I love this stretch, but really focusing on breathing, easy, gentle movements, really focusing on that posterior chain and getting those muscles to relax, then also working on a few of those pelvic mobility exercises.